Next is about Athatah Amanusha Upasarga Pratishedam Atyam Akyasyamah Yathovata Bhavan Dhanantarihi. Amanusha Upasarga is something like infective pathology, where certain organisms that are not visible to the eye and which affect the health of the person or which possess the person, and hence they produce the disease. Now that word possession has maybe two perceptions. One is about the popular perception, like possession means like something demons which occupy and so on. Probably the idea of Sushruta in this case would be considering the same, like demons and other extraterrestrial bodies which could be producing the disease conditions. But at the same time, the infections by microorganisms which are not visible also may be considering the same. Now, all these organisms which can produce the pathology, they are considered as a nishacharaha. Nishacharaha, they tend to move about, or they tend to be active at night, and hence they have the human body has to be protected against, defended against the possible infection in such condition, particularly when a person is either diseased or has a wound. And hence Sushruta says Nishacharebhyo rakshastu nityameva kshaturaha iti yat pragabhitam vistarah tasya vakshate. Previously in the Vrana chapter, this fact is mentioned, like the persons have to be protected against the Nishachara in case of wound, Vrana condition, or in any other disease conditions, and their detail is mentioned now. Guhya anagata vijnanam anamastha asahishnuta kriyava amanushi yasmin sagraha parikirtire. Now, in the infective conditions in the body can produce two forms of representation. One, it could be presenting in the form of a disease, or the other will be the personality changes. Now, in this chapter, it is about the personality changes which are produced as a result of these infection, or the other way, which is now perceived as the possession. And once these affects the human body, the person would be able to know something which is hidden, or many of the secrets can be known, or a person who can predict about the future, or the person may have a unstable personality, or a person may have a intolerance, or amanushikriya, something which is not human, superhuman activities done by a person, are the major clinical evidences of a graha, sagraha, the person who has been possessed by these organisms. They tend to affect the person who is having ashuchim, bhinnamaryadam, kshatam va, yadiva akshatam, himsa viharartham, satkarartham utapiva. These organisms may affect the person either with the two intentions. The intention could be either himsa viharartham, to harm the human body, or they may expect some respect from the human body, to expect the respect to get the respect from the human being. They tend to affect the person, and they can affect easily a person who is having an unclean personality, or who is not maintaining the personal hygiene, unhygienic conditions, or those who do not follow the normal norms. Bhinna Maryadam is the normal norms, the healthy norms are not followed, or there could be a wound. Many times, even without a wound, the organisms can affect. And these organisms are asankhyayaha grahaganaha grahadipatayastu te vyajyante vividhakaraha bhidyante te tathastada. These are categorized, are innumerable numbers. These organisms could be innumerable numbers, and their groups also are innumerable. And there are certain grahadipati. Grahadipati is certain of the super organisms which can have a categorization, which can be identified by their categorization. They could be innumerable, but for the sake of convenience, they are categorized into 8 categories, and they are devaha, tatha shatruganaha, tesham gandharva, yakshaha, pitaro bhujangaha, rakshamscha yapi pishacha jati, eshav ashtako devagano grahakyaha. The first is devagana, and the devagana, there are devas, that's something like the celestial bodies. Shatruganaha, something like enemies. Gandharva Yakshaha, these are again the celestial bodies which are somewhere between that Devagana and the human being, in between the as Pitaraha. Pitaraha is the even previous generation. The human being which after death they are supposed to have a status in between their ultimate goal and ultimate union with Paramatma. In between that's Pitaraha. Bhujangaha, snakes, Rakshamsi, which we call as demons, and Pishacha. Pishachas are those Pishidam Ashnatiti Pishacha, those which are having a taste for the fleshy food. These are the 8 ganas, 8 types of Devagana. And the Devagana affected person could be presented with the symptoms like Santushtaha, Shuchirapicha, Ishtagandhamadyaha, Nistandri, Avitata Samskrita Bhashi, Tejasvi Sthiranaino Varapradatta Brahmanya Bhavati Naraha Sadeva Justaha. A Devagana Justa person would be having a pleasant personality. He would be having extraordinary cleanliness, and he would be having the decorations of the body. Ishtagandhamadyaha, always having cosmetics, and Nistandri, doesn't feeling sleepy, he will be quite active. And Avitata Samskrita Vashi, he will always have or speak a decent, dignified speech would be there. Tejasvi, he will be very active, and Sthiranayana, his vision also would be very clear. And Varapradata, he can bless others, he has the capacity to bless others. Such a personality is called as a Brahma, this Devagana Justa, this personality. Then Deva Shatru Justa condition, Samsvedi, Dvija Guru Deva Dosha Bhakta, Dikmaksho, Vigatabhayo, Vimargadrishti, Santusto Bhavatija, Annapanajati, Dustatma Bhavatija, Devashatru Justaha. Devashatru is another of the type of organism, and such a person would be sweating more, and he will always find fault with the elders or teachers or so on, and his vision also will be somewhat oblique. He will not have a straight look as it, and he is not afraid of, he is quite bold, and his activities also are not unusual activities, and he will be happy with eating more different types of the food, and such a person is called identified as Devashatru Justaha, possessed with the Devashatru. Hristatma Pulina Vanantaropasevi Swacharaha Priya Parinita Gandhamalyaha Nrityan Vai Prahasati Chalpa Shabdam Gandharva Graha Paripidito Manushaha. A personality of Gandharva Graha would be having a very pleasant or enjoying the life as such, and he tends to move about like trekking and going on around into the forest and so on. And Swacharaha, he will be independent, he has his own type of characters, and he will be enjoying the music, art, etc. So artistic art, he tends to dance or he laughs more, and Alpa Shabdam, he will speak lesser. Such a personality is a Gandharva Graha personality. Tamrakshaha Priyatanu Rakta Vastradhari Gambhiro Drutamatihi Alpavak Sahisnuhu Tejasvi Vadri Jakim Dadami Kasme Yak Sa Yakshagraha Paripidita Manushaha. Yakshagraha Paripidita personality would be a person with Yakshagraha would have a reddish eyes, and he will be more attracted by the dress and appearance. He will always be careful about that. Rather, he will try to present in such a manner that the person will be identified with his dress or maybe the look as such, and he will be always serious, and he has a sharp speech and a sharp mind also. He is tolerant about the stress and Tejasvi. He will be quite active, and he will be always trying to give something to others, donating type of personality. That kind is Yakshagraha Paripeditaha. Pretabhyo Visrujati Samsareshu Pindan Shantatma Jalamapicha Apasavyavakstraha Mamsepsuhu Tila Buddha Payasapikamaha Tadbhukto Bhavati Pitragraha Vibhutaha. Pitragraha involved person would be always thinking of the previous generation or the dead things, demons, Preta or demon something like, and he tends to please those, the extraterrestrial organisms, and he will be cool otherwise, and tends to eat fresh or tiraguda payasa, sweet object substances, such a person is called as a Pitragraha Abhibhuta. Bhumo yah prasarati sarpavat kadachit srikchinyo vilikhyati jihvaya tatheva nidraluhu gudamadhu dugdha payasepsuhu vijñeyo bhavati bhujangamena justaha. Bhujangama or Bhujanga type Naga or that demon of these extraterrestrial organisms representing the snakes. If it is possessed, such a person tends to lie down on the floor and tends to move around in a creeping manner, and often he uses his tongue to taste or rub or so on. Those who tend to count the note by touching the tongue and so on, or Nidral who tends to having sleepy activity, he tends to prefer to sleep more and tends to eat more sweet drug substances like Buddha, Madhu, Dugdha, Payasa, etc. Such a personality is the snake type of the personality. Mamsasraka vividha suravikara viksuhu nirlajyo bhrisham atinishro atishuraha क्रोधालु विपुलभलो निशाविहारी शौचद्विट भवति च रक्षसाग्रहीतः. Rakshasa graha pidita personality would be he tends to have eat more of non-vegetarian food or alcoholic preparations, and nirlajaha, he is shameless, and he will be atinishuraha, very harsh, but at the same time very brave also, and tends to become angry very easily and very strong, tends to move more at night, and shauchat beauty, he doesn't like the cleanliness. Such a personality is a Rakshasa Graha personality. Uddhastaha Krisha Parusha Chirapralapi Durgando Bhrisham Ashuti Tata Atilolaha Bakhvashi Vijana Himambu Ratrisebi Vyavigno Brahmati Rudan Pishacha Justaha. A Pishacha Graha Justa personality would be having very weak appearance, and he will always grumbling on others, and he will be having unhealthy look, smells badly, and keeps himself unclean, and he will be always attracted by some external attraction, eats more, and he tends to move about in the night as such, or in those places where there are not many people. Such a personality is and he always tends to very unstable mind, tends to weep easily. Such a person is called as or identified as a Pishacha Graha Justa personality. Stulakshaha Tvaritagatihi Swapenalehi Nidraluhu Pataticha Kampatecha Ati Yascha Adi Viradana Dadi Vichudaha Samsasto Bhavtija Bardhakena Justaha. Vardhaka is a type of organism, this extraterrestrial issue, which can produce a personality where the person would have a very big eyes and tends to be very rapid in movement, and would have more of salivation and tends to eat the saliva. Nidral who tends to sleep more and has a tremors-like activity, and tends to move or climb mountains, or tends to move around in the or fly in the sky or so on. Such a personality is the Ardhaka personality. Devagraha Purnamasyam Asuraha Sandhigarpi Gandharvaha Prayasho Astamyam Yakshascha Pradipabhyatah Krishnakshaye cha Pitaraha Panjamyam cha Guragaha Rakshansi Nishipaisha cha Chaturdashyam Vishanticha. They tend to affect these these organisms tend to possess a human being at certain interval of the day or certain times as such, and they are in Devagraha, they tend to affect in Purnami, like full moon day. Asuraha Sandhya, Asuraha, they are in the evening, they tend to harm person in the evening, and Gandharvaha on Ashtami, 8th day of the fortnight. Yakshascha Pradipadi, Yakshaha on the first day of the fortnight. Krishnakshaye cha Pitaraha, Krishnakshaye is Amasya Pitaraha. Panjamyam cha Uragaha, Panjami, the Uragaha snakes, they tend to affect on 5th day of the fortnight. Nishamsi Nishi, Rakshamsi Nishi, they tend to Rakshas, they tend to affect at night. And Paishacha Chasurdashyam Pishachas, they tend to produce or affect the person on 14th day of the fortnight. Darpanadini Yathachaya Shitosnam Pranino Yatha Somanim Bhaskarasthyosraha Yatha Deham Dehadraga Vishanti Cha Nadrishyante Graha Tadvat Sharirinam. The affected person, that process of involvement, process of affection, infection is not visible, like Sushruta gives the similes of that possession, process of possession, like as you look at your shadow in the mirror, but you do not really get into the mirror. Similarly, when the person, any animal, creature, would have some cold or heat bodies, like temperature changes in the body, you cannot just make out how the temperature changes occur, or the reflection by a crystal of sunlight. That process we are not able to see that how that light enters in and how it is reflected. Such a situation does occur when the possession occurs. That whole process of possession is not visible to the naked eye. That's all the point. तवांसि तीव्राणि तथैव दानं व्रतानि धर्मो नियमाश्च सत्यं गुणाः तथा अष्टौ तेषु नित्याः व्यस्ताः समस्ताश्च यथा प्रभावम्. Those who have a very dedicated persons, tapas is a dedication, or those who donate to others easily, and those who follow the normal rules of the life, dharma, they are better protected. Nate manushyaih sasamvishanti, nava manushyaan kvachid avishanti, ye tu avishanti iti vadanti moha te bhuta vidya vishayat aposhaha. Now they tend to get into the body. It's not true. Now according to Shishra, it's not that they get into the body, but they change the personality, and hence these organisms, celestial organisms, they do not live with the human beings, or they do not cover up the body. And those who say that they live with the human being, they are not really experts according to Shishra. तेषां ग्रहाणां परिचारकाये कीटा सहस्र अयुत पद्मसंख्याः असृग्वसा मांसभुजस्तुभिमाः निशाविहाराश्च तमांशन्ति. The next level after the celestial organism, the next level is the Kita Sahasraha, the real infecting organism, what we now call as the microbes. Microbes are the products or the medium of transmission of those celestial organisms, grahas, into the human being. This is a very interesting issue, and they directly enter into the body in the form of maybe innumerable numbers of species of organisms. Koti sahasra yuta padma sankhyaha. They could be crores, thousands, and so on. Such numbers of species of them there, and they directly affect the tissues of the body, like asrut vasa mamsaha, and they tend to produce the disease signs. Nishacharanam tesham hi devaganam ashritaha tetu tat sattva samsargata vijnayastu saranjanaha. The color and appearance of these microorganisms which directly affect the body and which act as the conveyors of those celestial grahas, they have the similar qualities of their products, like Devagraha affected organisms or organisms which convey Devagraha. They will have certain characters which are similar to the Devagraha or so on, so they tend to produce the same. Devagraha iti punaprochante ashuyashtaye devavaccha namastyante pratyarchante cha devavata. The Devagraha organisms from the category of Devagraha, they would be always clean, but they tend to affect a person who doesn't maintain the cleanliness, and they tend to get respect from the human body. Now, when it comes to question of microorganisms, the microorganisms are in two categories. There are certain commensal bacteria and then the opportunistics. Commensals are the normal bacteria which are present in the body, and they are essential to the body, and as long as they are present in the body, many of the physiological functions of the body are dependent upon them, and they may be of that kind of category, like what we call as Devagraha derivatives. Swami Shila Kriyacharaha Krama Yesha Suradishu Niruptehi Yadustri Duhitaraha Kasante Prasavasnutaha. They tend to multiply due to the activities, or depending upon the activities of the person on which they are processed, like the commensal bacteria, their number of division would be depending upon your physical activity as well as the environment which are present over there, or due to your food, the consumption of food. Satyatvad apavrutteshu vrittistesham ganeshkritaha. The those who follow the normal norms of life, they would not just harm you. But once you change your habits or once the environment is changed, they tend to become harmful. That commensal bacteria may become opportunistic. Whereas the other bacteria, which are really pathogenic, they tend to produce the disease. Once they enter into the body, they will always produce the disease. And those are himsa viharaha. ये केचित् देवभाव उपासिताः भूतानि इति कृत्वा संज्ञां तेषां संज्ञां प्रवक्तृभिः. There are certain of the organisms which have a tendency to harm as their quality, which we now call as pathogenic organisms, which are not normally present in the body, and they often may look like, they may behave like the commensal bacteria, and they may produce the harm as such. So, kechit deva bhavam pashitaha. At times they misguide you, like graha sanjani bhutani yasmat eti anaya bhishaka vidyaya bhuta vidyatvam ata eva nirichyate. Because it is all related to the graha vidya, this branch of science is called bhuta vidya, microbiology. Now, those changes of personality, they are now categorized as the personality disorders by the current, and they are mainly considered as psychological variations. And as per the standard, the personality is categorized into 3 clusters. Now, it's not like 8 clusters, the 3 clusters like ABC. And again, further, there will be further classification of these cluster disorders. The cluster A disorders are paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. Cluster B's are considered as antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder. Cluster C would be avoidant personality disorder, dependent personality disorder, obsessive compulsive personality. These are the categorization of the personalities in the current method of psychiatry. Now, this is the psychology and psychiatric condition. And of course, if you compare them, they are exactly the similar issues of the features which you see in the Devagana, Rakshasagana, etc. Maybe the slight variations or number of divisions may be slightly different. So, I will not go into more detail about that, but there is something comparable to this. But in the present day situation, we consider these personality variations or personality disorders as a consequence of the genetic factors, environmental factors, or maybe the organic structure abnormalities like the injury to the brain and so on. The concept of something which is possessing from extraterrestrial is not extraterrestrial organisms, is not really identified or is not really accepted in the current methodology. Now, we will not go into the argument like who is right, who is wrong, or so on, but possibly as such the psychiatric factors, the diseases related to psychiatry and the personality changes, they are very poorly understood in the current science, in the current evidence-based science practice, and hence the argument of the other side also would be partially acceptable, though may not be, it's a part of debate. So we will not go into that complex issue of the debate like who is right or who is wrong. We will continue with our study. Dvesham shantyartham anvichan vadyastu susamaitah japaihi suniyamaihi homaihi arabheta chikitsidam. If you want to treat these graha, bhuta graha conditions or any of those graha possessed conditions, the option would be Daiva Pasha Chikitsa like Japa or Niyama, Homa, etc., which we are now are considered as something like superstitious in the current method, but whether it is really superstition or whether it is really something, the real fact, is again the questionable issue, debating issue. We will not go into that part. Raktani Gandhamalyani Bijani Madhusakvishi Bhakshashta Sarve Sarvesham Samanya Vijirichyate. The general protocols involved would be having the garlands of different colors or different flowers or different appearance, or providing madhu and sarpi and or maybe the eatables to the organism, to the possessed organisms in the form of bali is a common process. So that the organisms, they are pleased and they tend to move out of the body. Vastrani Gandhamalyani, it's not antibiotic, rather it is something where probiotic, a treatment where probiotic, where the bacteria, these organisms' growth is facilitated and they are pleased and they do not produce a harm to the body. वस्त्राणि गन्धमाद्यानि मांसानि रुधिराणि च यानि येषां यथेष्टानि तानि तेभ्यः प्रदापयेत्. The whole idea of treating these would be providing all that which is required by these organisms, which are demanded by the organisms, so that they will be pleased and they will not harm you. So the present approach to a infective pathology would be to kill the organisms, whereas the idea present in Ayurvedic point of view is to make them happy and then the organism should live. Now, practicably, how far this is practicable and whether it is true or not is again debatable point. But ideologically, this is a very strong ideology. This ideology is a very strong ideology, and in the current situation, we are overwhelmed by the idea of antibiotics and considering these organisms as enemies of the human body. It may be very difficult to pursue this issue, but if you think seriously, this ideology also has to be considered. Maybe it can be one of the ideology of the future, as we have now reached a dead end with the possibility of this kind of antibiotic policies, because we now know that there are superbugs and antibiotics are reaching to level where their activity is coming to maybe fruitless. Coming to that part, though not yet we have reached a level where they are absolutely useless, but we can predict that maybe in the future. So this again point is a very debating point, and maybe a certain issue or controversies will not go into that part, but very interesting issue as such. हिंसन्ति मनजान् येषु प्रायेषु दिवसेषु तु दिनेषु तेषु देयानि तद्भूत निवृत्तये. Now the offering these beliefs to these organisms would be based upon selected day and selected time and a selected protocol, and this would be the protocols are mentioned in the further. Devagrihe hutva agnim prapayet balim kusha vastika pupa apupa adya chatra payasa samdhutam. For the devagraha, there should be homa havana done in a temple or in an area where the presence of God is there, and then you have to give the bali, and the bali should have darba or swastika, that all so-called the pure or something like divine substances, and the food also like apupa adya and chhatra, the umbrella like structure is given, or payasa, sweet substances. Asuraya, for the Asuragana, Rakshasagana, Yathakalam Idyata Chaturadishu, Gandhavasya Gava, for the Asura, it should be Chaturadishu in a open place but covered area. Chatura is Chapara, Pendal. So in such Pendal like areas, it should be given. Gandhavasya Gava Madhye Mamsam Pujangalam. For Gandharvagana, when you have to offer bali should be given in Gava Madhye, in a cow shed with alcoholic preparations or non-vegetarian preparations. Hridya Veshmani Yakshasya Kulmasha Asura. In for the Yakshagana, it should be in a good house or good looking house, Hridya Veshmani. Good looking house as such, with the Kulmasha Dhanya, that's the Avare Dhanya, Asrak Rakta, blood or Sura, alcoholic preparations, they have to be given as the bali. Ati Muttaka Kundabdehi Pushpehi Vidre Balim, and it also should have for the Yakshagana, the flowers also have to be done, and then the flowers like Ati Muttaka Kunda, etc. Nadyam Pitrgrahaya Ishtam Kushasvaranam Bhushidam. For the Pitragraha, it should be in the river, near the river or in the river, with the Kushasvaranam, with the Darbha as such. Then Prataiva Apahetchapi Nagaya Vidham Balim. For the Naga also, it should be in the near the river. Chatushpati Rakshasasya Bhimeshu Gahaneshva. For the Rakshasagana, it should be in an area where 4 roads are converging together. The junctions of 4 roads are in forest. Shunyagare Pushatasya Tivram Balim Upaharete. For Pushatagana, the bali should be given in a Shunyagara where there are no living persons or empty house as well. पूर्वम् आचरितैः मन्त्रैः भूतविद्यानिदर्शितैः न शक्याः बलिभिर्जेतुं योगैः स्वान् समुपाचरेत्. The bali and mantras are one part, but the complete treatment would not be possible only with the bali and mantra. The other aspects, the drug regime also has to be followed, and those regimes are Ada Raksha Charma Romani, Shadra Kolukayostara, Hingu Mutram Jabastasya, Dhum Asiprayat, Etena Shaman Shipram Jabalanapi Ograha, Dhuma, Dhupana with the different skin or leathers of different animals or birds with the hingu or bastamutra, goat's urine. Dhupana is one of the options for all grahas. Then Gadahva Pipali Mula, Vyosha Amalaka Sarshapana, Godha Nakula Marjara, Rishya Pitta Prapeshana, Nasya Abhyajana Sekeshu, Vidaryata Yoga Tattuvita. The other medical treatment of different preparations for Nasya Abhyangana Seka also is suggested as a treatment. Now, this is a very interesting issue. Bhuta Vidya doesn't mean only those protocols which are not considered as medical, non-medical protocols like Bali. Bali is one part. At the same time, the other medical protocols also have to be followed, and these medical protocols are of different types, either Dhupana or Nasya Abhyangana Seka, etc. or Khara Ashwatara Uluka Karabha Shwa Shudaradam Purisham Vridhakakanam Varahasya Bastamutena Tatsiddam Tailam Tasya Purovadhitam. A taila prepared with the pieces of different animals like donkey, horse, and dog, etc. There are the purisha of birds like Gridha Kaka, Gridha eagle, or Kaka, cock, etc. Or Varaha. They are with the bastamutra, the goat's urine. You have to prepare a taila, and taila has to be given Nasya Abhyajana Seka par Nasya Abhyajana Seka, etc. Or Shirisha Bijam Lashanam Shunkim Siddharthakam Mujam Manjistam Rajanim Krishnam Bastamutrena Peshe Vartyaha Chaya Vishushkaha Tasam Sapitaha Nayananjanam Anjana with the best this Varti prepared out of Shirisha Bija Lakshana, etc. and prepared with the urine of goat that has to be used. Naktamala Palam Yosham Mulam Shonaka Bilvayo Hariteta Kradavartya Purvat Nayananjanam. Nayananjana is very often suggested protocol, and it could be prepared with the Naktamala Palam Yosha, etc. Saindavam Katukam Hingum Vayastham Tevachamapi Bastam Utrena Sambishtam Apsapikten Purvat, or you can prepare the Varti with these drugs like Saindava Katuka, etc. Ye Graha Nasidyanti Sarvesham Nayananjanam. It's one of the broad spectrum Nayananjana. Purana Sarpihi Lashanam Hingu Siddharthakam Macha Golomi Cha Ajalomi Cha Bhutakeshi Jatatha Kukuda Sarpadanda Cha Pratha Kaka Kanamika Anike Vajra Prokta Vayastha Cha Shringi Mohanavallika Arkamulam Tri Katukam Lata Soto Javanjanam Nepali Haritalam Cha Rakshogna Yachakirtaha. The general Rakshogna Dravyas list of drugs which are considered as Rakshogna are Purana Sarpi, Lashuna, etc. Then Simha Vyagra, Riksha Marjara, Dvipi Badi Gavam Tata, Shwavit, Sharja Godhanam, Ustasya Nakulasya, Wheat, Pak, Roma, Vasa, Mudra, Rakta Pitana Khadaya, Asmin Varge, Bishop Kuria, Taila, and Jagzanja. The skin or leather, blood or flesh of the different animals like lion, tiger, etc. They also are of the same category, and a Vaidya has to prepare a taila or ghata with any of these categories, like either plant drugs or maybe the animal origin drugs, substances, and they have to be that taila and ghata given Pana Abhyajana Nasyeshu Tani Yadyani Janata Apide Anjane Jeva Viradyan Butikai Kram Viradita Parisheke Kotitam Churnitam Tara Uddhulane Slakshnapistam Pradehe Avajare Yashat Sarovikara Sumanasaram Manasan Aparajitaha Hanya Alpena Kalena Sneha Dirapichakramaha. These protocols, substances may be administered in different manners like Pana Abhyajana Nasya or Avapidana, or with the Gutika or Parisheka or Uddhulana with the Churna. Now these are useful for these graha possession conditions as well as psychiatric condition. This is a very interesting issue. Sushruta has given a prescription which is common for psychiatric condition, manasa vyadhi as well as the graha vyadhis. And hanya dalpena karena sneha dirpita kramaha. This can be useful for treating such condition. Nacha achauksham prayogita prayogam devata grahe dvite pishata danyatra pratikulam na chacharete. When you say bali, the bali should not have these dirty contents, achauksha or something which is unholy contents should not there when you give the bali in a devata graha, in a temple or such divine situations. Whereas the ashaucha bali, that unholy contents are only for pishacha graha, and it should be at a place where either it could be like a lanes or union of four lanes, or in a shunyagara where there are no resident persons. Such conditions it should be given. Vaidyasura nihanyuhu te dhum kruddha mahojasah. If the bali protocol is not proper, then both the Vaidya as well as the patient may be harmed by these organisms. Hita hitiye yatyuktam nityameva samachare tatah prapsit siddhim jayashasya vipulam bhishaka. The most important part is the swastha which is mentioned in the Hita Hitiya Adhyaya. If you follow that the swastha, you are not going to get affected by these organisms for both the patients as well as for the physicians. With this we conclude the chapter. It is Sushruta Samhitayam Uttaratantrante Bhuta Vidyatantre amanushopasarga pratishedo nama prathamaodhyayah adita shashyatamodhyayah. If there are any questions, we will try to answer, and then right, there are no questions, we will wind up.